An independent from Maine. He's also a member of the Budget Committee. Senator, you're lucky to be in D.C. because Maine is going to get hit with a lot of snow later today, but you've got a lot of work to do in D.C. I want to talk about this health care bill. One of the biggest points in favor seems that it's going to save more than $330 billion. Is that a step in the right direction?
No, and I'll tell you why, Stephanie. That number is produced by shifting $880 billion from the Medicaid program from the federal government to the states. So, you know, I could save a lot of money, too, if we had the states take over the Air Force or the Marine Corps. It's shifting. The technical term is shift and shaft. Shift it from the federal government to the states and to the people in the states. So, you know, yeah, they show some savings, but they show it by stiffing the states. I don't think that's not really honest budgeting. The numbers are still there. The needs are still there. The people's use of the medical system is still there. So I understand them trying to tout that, but it's really not a victory if all you're doing is shifting the cost to somebody else.
Well, I want to share what the bill's defender-in-chief, Paul Ryan, had to say about it last night on Fox.
I'm really actually frankly encouraged. Even CBO was telling us we stabilize the market, we lower premiums, it lowers the deficit, it saves money, and more importantly, of course they're going to say if we're going to stop forcing people to buy something they don't want to buy, they're not going to buy it. Okay. That's why you have those uninsured numbers, which we all expected.
Okay, so the idea that people aren't forced to buy something is obviously a selling point for Republicans, but can health insurance work without a mandate?
Well, not if you're going to have the pre-existing condition provision. You can't really have both. If they like the pre-existing condition that you can't deny health insurance because of pre-existing conditions. Everybody seems to like that. It's popular, so they're retaining it. But if you think about that for a minute, if you have that requirement, but no requirement that you buy insurance at the front end, nobody would buy insurance until they're in the ambulance on the way to the hospital. I mean, the two are really logically linked. But the other thing I want to touch on that Speaker Ryan said last night, he said it stabilizes the insurance market. Actually, what the CBO report says, the insurance market is stable either way. A lot of the talk has been about the Affordable Care Act, the Obamacare, being in a death spiral. The CBO report says neither Obamacare nor the new plan are in some kind of death spiral, that both are stable, that the Obamacare market is now stable. So that's really not true. And this, again, this idea of saving, that it saves the federal budget, yes, it does, but it simply shifts that cost to the states. That's phony savings in my book.
All right, Senator, you're an independent, so by comparison, your heart and mind is open. Paul Ryan said that this is just part one of a three-part effort. Should Democrats sit back here and wait and see how the other parts look, or is this so bad to you it's just a non-starter?
I think it's so bad that it's a non-starter. I mean, 24 million people losing their health insurance is really a disaster. And these guys keep talking about a market. Yes, there's a kind of market in health insurance. You can buy different policies, but actually their bill would make it harder because it takes out one of the provisions of the Affordable Care Act that allows people to actually determine the actuarial value of the two policies, makes it harder to shop. But the underlying point is health care is not a market. When you go in to buy a car, you can compare cars, you can know what the price is, and you know what the quality is, you can test drive. When you go into a hospital, and they tell you you need a stent, you don't have any market power. You don't have any ability to negotiate or go to another hospital or say, I'm going to test drive this stent. The idea that health care is some kind of market is just not true. And what they're saying is, yeah, people can have choices. Well, I have a choice to buy a Maserati, but that doesn't mean I have the ability to buy one. And in many cases, particularly for seniors, their plan drastically increases costs. So, yeah, you might have a choice to buy health care, but it would take more than half of your annual income, and that's not really a real choice at all. So what we really ought to do is take a deep breath, drop this proposal that's, I think, a disaster on virtually all fronts, and start all over again. And let's work together to solve the problems. And I agree there are problems with the Affordable Care Act, and repair it so that it works for the American people. But the bottom line is that what they're doing is cutting taxes for wealthy people. That's a big part of this bill. and cutting subsidies, particularly to people over 50 years old and people with lower incomes. These are working people, by the way. These aren't people on welfare. These are working people that are going to lose their ability to buy health insurance.
Coming together and working together and negotiating is precisely what President Trump said about this bill. I want to share that.
We're negotiating with everybody. It's a big, fat, beautiful negotiation, and hopefully we'll come up with something that's going to be really terrific.
We're working together. We're going to come up with something terrific. That sounds great. But are Democrats part of those negotiations? Do you know about this working together effort?
Not that I know of. I mean, in the House, they basically had 2 long committee sessions. They didn't have hearings on the bill. The bill was under lock and key until Monday night. They had their markup sessions on Wednesday. There were no negotiations that I know of, and they ended up passing the bill out of the committees pretty much as is. I know of, now maybe there are negotiations and I'm not included, but I know of no serious negotiations. It's basically they're trying to move this bill through as fast as possible, and I understand that because it's so terrible that the more people learn about it, the worse it is. The other thing that bothers me, Stephanie, is this attack on the CBO. The CBO is, in fact, nonpartisan, but it's led by a Republican. The guy who's the head of the CBO was hired by Paul Ryan and Mitch McConnell 2 or 3 years ago as a Republican, worked in the Bush administration as an economist. They're straight shooters. And they may not like the numbers that they came up with, but they're as good an estimate as we're going to get from an unbiased source. So again, I don't know of any negotiations. If they would just back off and quit talking about repeal and talk about, you know, how can we fix the problems, but still keep people insured. The Affordable Care Act cut the uninsured rate in half in this country, almost in half, and this bill would put it right back up where it was before and essentially almost double the uninsured rate. I don't know how that's good for anybody. It's not good for the country. It's certainly not good for the people that need that support.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.